Swawadika and good afternoon. Welcome back again to the English language summary of the daily press briefing on the COVID-19 situation in Thailand, live from the Center for COVID-19 Situation Administration, or the CCSA. For today's briefing, which is Monday, the 21st of June, 2021, we have quite a lot of information to share with you. And this is because today is the start of a new set of relaxation of measures, which was announced since last Friday. And I will talk about some of these new set of measures in detail later. But please rest assured that as we commence the relaxation of measures, the CCSA has a standard operational procedure, or an SOP, in place. And this is a reference for authorities to use whenever the benchmark is breached. Once this happens, it will trigger an emergency response system to conduct active case findings in high-risk areas where clusters have been detected, and a revision of disease control measures will be administered to curb local transmissions. Thailand's plans and measures are based on our previous experience to prevent risks to public health and detrimental impact to the wider public. And the gradual step-by-step approach to the relaxation of measures has been carefully considered and calculated to maintain public health safety while opening opportunities for people to continue to earn livelihoods and for Thailand's own economic recovery. Also, the much-awaited Phuket sandbox will be considered by the Cabinet tomorrow, and when approved, it will be published in the Royal Gazette. And this proposal will waive quarantine requirements for foreign national travelers who have been fully vaccinated against COVID-19, and they will be allowed to enter Phuket starting from the 1st of July. And Phuket will be the pilot project, as I mentioned before, towards our goal of reopening the country by October 2021, which is the goal, the target set by our Prime Minister. And we hope to reach this target, and in order to do so, we ask for all sectors of society to work with us to achieve this goal. Let me move along now with the number of vaccinations, the progress we have achieved today. The number we have is, as of yesterday, we have administered over 91,000 doses of vaccines. And so this brings us to a total number of vaccinations to over 7 million doses as of today. And this is since the 28th of February when we started our vaccine campaign. Now let me move along to the general situation, the number of statistics we have in today for the new confirmed cases of infections. We have today standing at 3,175 cases. In that number, we have the total number of active cases that are being treated in medical facilities today, standing at 33,859. So within this number, there are 1,436 who are in critical condition, 395 on ventilators. The number of new recoveries we have today stands at 2,030 cases, and that brings us to a total number of recoveries standing at 185,789. The new number of fatalities we have today, very regretfully, stands at 29 cases, and Bangkok again has the highest number of fatalities, standing at 17. And this is followed by Samut Prakan at 6, Pathum Thani at 2, and Saraburi and Nakhon Ratchasima, Narathiwat, and Songkhla, 1 each. So today I would now talk about the new measures that we have in effect since actually midnight, since last night, and Dr. Apisamay just kindly briefed us on this set of new rules. Let me start by the new zoning, nationwide zoning, in accordance with the degree of infections we have over the country. We've readjusted these zonings, and we have now altogether 5 zones. The first zone is the dark red zone, which indicates a strict and maximum control. Second zone is a red zone, which is a zone for maximum control. The third zone is orange. This orange zone is a zone for controlled areas, and the fourth zone is yellow for high surveillance zones. The last zone is a green zone, but unfortunately we don't have any provinces within that category yet. So the dark red zones we have today, they include 4 provinces, which are Bangkok, Nonthaburi, Samut Prakan, and Pathum Thani. And in the red zones, there are 11 provinces, and these include Chha Cheong Sao, Chonburi, Trang, Nakhon Pathom, Pattani, Phetchaburi, Songkhla, Samut Sakhon, Saraburi, Yala, and Narathiwat. Within the orange zones, we have 9 provinces, and these are Chanthaburi, Nakhonศรีธรรมราช ประจวบคีรีขันธ์ Ayutthaya, Ranong, Rayong, Ratchaburi, สระแก้ว and Samut Songkhram. The remaining 53 provinces, which are the majority of the provinces of the country, are all in the yellow zones, which is for high surveillance. And for the specific measures for each zone, we will post information for you to look up and see what you must do to follow the precise measures. So you can look up these measures in our social media accounts and also the website of the Ministry of Public Health. And now let me move on to some important relaxation of measures that have been announced by the Bangkok Metropolitan Administration, or the BMA. This is some good news for all of us who are feeling a little bit the fatigue of restrictions that we've been having to practice for such a long time. And this is also in tandem with the relaxation measures that the CCSA has announced within the dark red zones. So these measures include allowing restaurants in Bangkok to operate until 11 p.m. or 2300 hours. Unfortunately, the ban on alcohol consumption within the restaurants still remain in place. Also, for restaurants that don't have air conditioners, that are open air, they are allowed 100% seating capacity. For those restaurants that are air conditioned, they are allowed only 50% capacity seating. Entertainment venues, including karaoke bars, pubs, and discos, have to remain closed. However, department stores are allowed to operate until 2100 hours or 9 p.m. The Bangkok Metropolitan Administration has also allowed public swimming pools and other water sports facilities to reopen, and sporting events without spectators are also allowed, and I'm sure this is very much welcomed for many of you who depend on physical therapy. Also, education centers, science parks, and public and privately run libraries are also allowed to reopen. However, gatherings are only permitted for a group of no more than 50 people, and mandatory wearing of masks in public venues also remains in place. And allow me to stress that the relaxation of measures means that we must exercise even more stringently our personal hygiene precautions to minimize the risk of infections. And this is how we will learn how to live with COVID safely. So, while the pandemic has stretched our public health facilities and quite devastatingly caused adverse effects upon our economies across the world, it has also brought out the best in many of us as nations and societies unite to help each other through this historic crisis. And I'd like to show a slide today, a very inspirational young lady. We've seen volunteers in Thailand of all ages today and across many professions. And they've come in, just volunteered to render their services to the local community as well as the CCSA. And we'd like to express a big thank you and our very sincere, deepest gratitude to all of them who have just come, to contribute and just wanting to make a difference. What we've learned with this pandemic is that we need the collective efforts and goodwill of the people and all sectors of society to help us move forward and eventually enable us to see the light at the end of the tunnel. On the screen, this young lady is actually an 8th grader volunteer who heard that CCSC University was recruiting volunteers for its vaccination drive. And she requested permission from her mother to help out at the center and was initially rejected for being too young. But as she insisted, we, at the end, allowed her to assist. And people have posted. And on the screen there is, you will see volunteers from the Thai Red Cross. And these are the volunteers from the Thai Red Cross, nurses and doctors. I'd like now to respond to a question from the media about a particular cluster of infection in Yala province, which Dr. Apisamai had just now briefed us quite in detail. I'd like to provide the following update. As of yesterday, 20th of June, the doctors, our public health authorities have detected 102 confirmed new infections in Yala. And altogether, from this particular cluster, we have detected 402 cases over 11 provinces. These are linked to this particular cluster in Yala. And measures have been taken to seal and curb the spread, and these include the sealing off of the high-risk area which the index case was found, and there's still going on some active case findings and testings, and raising awareness to the people in the high-risk and low-risk areas on disease control measures. We will provide any more updates to you about this case later on. Before I end my briefing, I'd like to bring to your attention an infographic from the WHO, the World Health Organization, on the importance of taking health precautions even after vaccinations to protect our family and friends and yourself. And this is because you could still get infected before your body has built up immunity and even after vaccination. The WHO has consistently advised that although vaccines are vital to fighting this pandemic, it is not the sole solution or the holy grail to prevention against the coronavirus infection. We do not want to raise a false sense of security after vaccinations, and therefore, we want to remind each and every one of us that the best prevention scheme is maintaining a combination of health precautions, which continue to be disease control measures, public health and personal hygiene, as well as vaccinations. And therefore, to protect yourself and others, we advise you to consistently and strictly practice DMHTT and to avoid poorly ventilated areas. And these preventive measures will eventually help keep our communities safe and return us to our normal lives as soon as possible. And this is all I have for you today. Thank you for your kind attention. Stay safe, stay healthy, and we'll see you again tomorrow. ขอบคุณค่ะ สวัสดีค่ะ